After a prostatectomy, a client is diagnosed with a major complication of hemorrhage and hypovolemic shock. Which of the following is the initial nursing action? There's a few keywords here that are extremely important. The condition, prostatectomy. There's not a lot of information about the client. The client was diagnosed with a major complication of hemorrhage and hypovolemic shock. So we know that this patient is bleeding. This patient has a physiological need, specifically circulation. So we know that the client's problem is a circulatory problem. Which of the following is the initial? The word initial tells me that I'm looking for the first answer. We have monitor vital signs, administer a vasodilator to improve the client's blood pressure, administer intravenous fluids, and record intake and output. What an interesting scenario. And answer number 1, or A, monitor vital signs, is an answer that I see very often. Okay? Now, are we going to be doing an assessment, like answer number 1, or are we going to be doing an implementation, like answer number or letter C, administer IV fluids? What is the priority action? What is the initial nursing action? Let's use the critical thinking. If you analyze this scenario, you have determined that this is an emergency. And in emergency scenarios, are you thinking about doing an assessment or an implementation? If your patient is in distress, do not assess, implement in most cases. So I'm looking for an implementation. So answer A, I can eliminate because this is an assessment. Recording the intake and output, administering IV fluids, and administering a vasodilator, they are implementation answers. Now, I can continue using critical thinking. And we have two answers that are related to another. For example, the administration of vasodilator and the administration of IV fluids. Each one of these answers is going to do a different effect on the circulatory system. For example, if I administer a vasodilator, what is that going to do to the blood pressure? Is it going to increase the blood pressure, or is it going to decrease the blood pressure? And remember that the patient is in hypovolemic shock. So the patient is going to be hypotensive. The patient is in shock. So I need to do something that increases the blood pressure. A vasodilator will decrease the patient's blood pressure further and will cause more problem. B is eliminated. Now, administering IV fluids. Is that going to help with hemorrhage? Yes. Is that going to help with hypovolemic shock? Yes. So letter C is a very good answer. And D, recording the intake and output. Do we record intake and output in a patient that is in a hypovolemic shock? Yes. Is it the priority? Well, very simple. Ask this question. Between letters C and D, which answer helps the patient's condition? Administering fluids or documentation? Obviously, administration of fluids is going to help the patient more. Remember, documenting is your last action to take. You document once you have done everything that you can do to help the patient.